Has your baby been diagnosed as a hip dislocation? Do you suspect that the baby's hip is dislocated? This video is then for you. My name is Dr. Sanjay Sarup. I am the Director of Children's Orthopedics and Spine Surgery here at Artemis Hospital. First, I think we must consider what is a hip dislocation. For this, I will use a model. This is the model of a hip. The hip joint has two parts, the femoral part, the leg part, and the pelvic part. The pelvic part has a cup. It's called the acetabulum. And the femoral side, it has a head, a ball, and both of them joined together like this. So this is a hip joint. When we move, it moves like that. When the head comes out of the socket, it's called a hip dislocation. When it is present at birth, it is called a congenital hip dislocation. It may not be totally dislocated. It may just have moved out slightly, then it's mild subluxation, or a lot more, then it is a moderate or a severe subluxation, and then the third step would obviously be a dislocation. In this situation, whether the hip is partially out or totally out, there are always some abnormalities. One is on the cup side. The cup may not be deep. It may be quite flat, like a saucer, and it's unable to grab the ball portion. So its shape is changed. This is called dysplasia. Similarly, the femoral head, it may point too far forwards, like that. Or the head may be misshapen. Again, this is dysplasia. Dysplasia means abnormality. And the third thing that is always present is that the soft tissues that bind these together are loose. They allow the hip to move in and out. Therefore, this condition is now called developmental dysplasia of the hip. So, when do you suspect that your child may have a hip dislocation? Number one, the position of the baby in the womb is in breech. Breech position means the head is upwards, the bottom is downwards. Usually, the baby is in the womb with the head down. So when the head is up, it is called breech. Second, when this breech baby is a female, because a breech baby that is female has a higher incidence of dislocation. Third, when this baby is a firstborn. So if you have a breech baby who is a female and firstborn, you should always get a checkup by your specialist, by a pediatric orthopedic surgeon. And fourth situation is when anyone in your family, amongst your relatives, has been diagnosed with a hip dislocation. What all do you see which would make you suspect that there is a hip dislocation? One, the thigh creases on the baby are asymmetrical. They are in different places. Second, the leg is shorter. Third, when you spread the legs, they are unequal in spread. One side spreads more and the other side spreads less. Fourth, when the child starts walking, there is a limp. So what should you do if you suspect such a situation? You should always see a specialist, somebody who specializes in children's orthopedics and who is a specialist with children's hip disorders. You have to remember that early detection results in early treatment. Early treatment is totally non-surgical, it is very simple, it is very low cost, and it is highly effective.